name's Dr. Fires. Pleasure to meet you, sir. Would it be alright if I examined your chest, sir?
Yes, do carry on.
Thank you, sir. Just lower this a tad, sir. You take a deep breath in and out of your mouth, please. That's grand. Just breathe normally. That's fine. Can I just have a look at your hands for me? And the other one. So that's cool. Just turn your palms over for me. Okay, that's fine. And that, rest that one back. That's great. Look up for me. And look down. Stick your tongue out. And say, oh. Oh. That's fine. I'm just going to feel in your neck. Can I get you to sit up for me now, please, sir? No signs of any scars at the back. Right, deep breath in. And all the way out. All the way and hold it. Now, deep breath in. That's grand. And now breathe normally. Deep breath in. And all the way out. And deep breath in again. It's grand. Just going to tap on your back. Just breath in and out of your mouth, so deep breaths in and out. You good? Okay. Breath in. Just going to feel it in the back of your neck. Lie yourself back for me, sir. Deep breath in and out. And deep breath in again. And out. And one more time, deep breath in and out. And hold it. Deep breath in. That's grand. Breathe normally. Deep breaths in and out of your mouth. And out. And again. One more time. Just going to have a look at your legs now. There's no tenderness at the ankles, is there? If I press?
No.
Okay. Press there. Thank you very much, sir. That concludes my examination.
Right.
Mr. Barnes presents a patient with a case of bronchiectasis with yellow nail syndrome. The clinical signs to look for when you go to the end of the bed is to get Mr. Barnes to take a deep breath in and out. There should be symmetrical expansion unless there's a large pleural effusion on one side, as occurs in yellow nail syndrome. And if there is symmetrical expansion, you know there is widespread disease process within the lungs that you're going to be looking at. When you examine Mr. Barnes, look for clubbing, yellowness of the nails, look for central cyanosis. There is none of that in Mr. Barnes' case today with regards to central cyanosis. His trachea is central. When you examine the chest, I would always argue that you examine the chest from the back, because that's where the vast majority of your clinical signs for most respiratory examinations are going to be. Look for any thoracic surgery that may have been done previously. There isn't any in Mr. Barnes' case. On examination, expansion is symmetrical, percussion notes are resonant, and therefore I did not go on to undertake tactile vocal fremitus or vocal resonance, because there was no asymmetry in my percussion note or my expansion, and there was no thoracotomy scar. On auscultation, there are two audible abnormalities. The first one was that there was widespread polyphonic wheeze, which classically can occur in bronchiectasis. Wheeze implies an obstructive airways disease, whether it be asthma, bronchiectasis, or emphysema and COPD. Mr. Barnes also had quite coarse mid-inspiratory crackles. These changed in character, though they did not go away when I got him to cough on both sides. I did not see any sputum pods at the bedside, but when you're at the end of the bed, it's important to look for these, as well as oxygen dependency. There were no cervical nodes. When I got Mr. Barnes to lean back, I examined him from the front, as well as examining the sides and into the axillae. Again, the only issues of note were that there were mid-inspiratory coarse crackles on both sides. He does have bilateral dependent edema, implying that there may be an element of cor pulmonale. However, there is no central cyanosis present. When you look at his toes, they also have a yellow tinge to them, in keeping with the yellow nail syndrome. Mr. Barnes has bronchiectasis with yellow nail syndrome. On examination, he appears well at rest, he is not dyspneic, chest expansion is symmetrical. His nails are yellow in colour, especially in the toes, less so in the fingers, as normally you would expect both fingers and nails to be yellow. He is not centrally cyanosed or peripherally cyanosed, he is not clogged. His pulse is 85 and regular. On examination of his chest, there are no thoracotomy scars. His expansion is symmetrical, both anteriorly and posteriorly. Percussion note is resonant throughout the chest. On auscultation, he has wheeze, in keeping with an obstructive element of his respiratory disorder, which occurs in bronchiectasis, as well as coarse mid to late inspiratory crackles, which change in caliber on coughing, again in keeping with bronchiectasis. And there are no supraclavicular nodes. On examination of his legs and his spine, on the spine there is no edema, but his legs are bilaterally enlarged with pitting edema present, and again yellow tinge to his nails. This in keeping, because it's pitting, with ankle edema, which may be an element of cor pulmonale. Important to note that there are no evidence of lymphedema in the arms, which again occurs with yellow nail syndrome. In summary, therefore, Mr. Barnes has bronchiectasis in the presence of yellow nail syndrome. He has bilateral pitting edema at the ankles, which may imply an element of cor pulmonale.